So we are here today to do Christian's neurotoxin. So we're doing some Daxxi on her. It has been probably about 4-ish months since we treated her. And if you look at her angry face, she's not even like fully back. So she's still holding on tight, but a lot of people just in general, their frontalis or their forehead, those muscles will move a little bit more. So when she lifts up, you can see that little line and it's driving her crazy. I get it. So we're gonna soften that. When she smiles big, she doesn't have like a whole bunch of crow's feet either. I feel like in this area, generalized, she's doing pretty good with her Daxxi, but let's dose her some more so she can be nice and smooth. Okay. So we already got her pictures and consent. She's looking like a cutie. I'm gonna clean her up with some alcohol. Put her head back. So with Daxxi, we know that for a full dose, you're going to be using anywhere from 100 units to 120 units of that neurotoxin to really get some good, long-lasting results. I do still think that it's the prettiest neurotoxin I've ever injected. It's just gives you like this glow, right? Okay. So let's mark her up. So do your angry face for me. So really not moving much here. Lift up high for me. Relax. Lift up high. What are you marking? I'm marking out where I see her wrinkle pull. So you can see right in this little area. She's pulling. We don't want to go too low, because if we do go too low, basically like 2 finger breaths below, we can make her feel heavy, right? And so nobody wants to feel like that. You want to feel light and heavy. She said before we started doing it, I like that I could still move my brows with Daxxi, even though she felt nice and snug. So I'm kind of just marking her out where I see the movement and where it's still like safe to inject without making her brows drop. Okay. This was for her 11s, her angry face. So there's 5 different locations we inject there. This is a complex of muscles and they all kind of work together. So we never want to hit, we never want to just do your forehead and not do this, because you won't feel stable and your brows will definitely feel heavy. So smile big for me. So for her, I'm going to make sure to lift her brow really nicely. You're pretty veiny too. So I'm like seeing all of her vessels.
I'm translucent.
She's translucent. Sorry. When would you say you started getting Botox, Christian?
So I'm gonna say I was 26, about 26. I'm 31 now.
Yeah.
So I definitely see a major difference. Of course, whenever I don't have it, I feel very, very unprepared without it.
Unprepared for
For lack of
life.
better words.
Unprepared for
Yes.
Yes, I started when I was about 26 getting it, and it's been over a decade, and I think I'm doing okay.
Yeah.
So we'll get you to make your faces. Angry face, relax for me.
I can't even feel that.
She has her little nerve stimulator right there to distract her. They're the tiniest needles too. If you look here, they're so small. It's an insulin syringe, so it's very small. It looks like a little bug bite.
How long does this take to work?
So I would say that Daxxi is one of the quicker ones for me. Usually for me, it takes about 10 days for me to see results. Regardless of any neurotoxin, it's going to take 2 weeks for you to get your full result. Within about 36 hours, I could barely move my angry face. And in about a week, I was pretty frozen on my forehead.
Do you have Daxxi right now?
I do.
me see.
So I can't.
Oh, yeah.
I was just telling her, I feel like I'm crossing my eyes. I cannot make
You
an
cannot
angry
make an angry face at all.
If I lift my brows, it's me lifting my brows. But yeah, there's nothing moving right now. I was laughing the other day because I was laughing and I couldn't move, so it made me laugh harder. I was like, well, this is wonderful. But
You
that's
have the
what I
best
wanted.
laugh.
Yes. I have a loud laugh. I'm sorry.
I love your laugh.
Are you doing okay?
Yes, ma'am. I don't feel a thing. So within Daxxify, like, I know there's a specific word and I just can't think of it that like is causing us to feel that, like, see that glow.
So, Daxxi, there are not studies yet, but Daxxi is made with a peptide, and we do know that it's made with a peptide, right? There are thoughts that the peptide actually helps the skin because skins love peptides, so it kind of gives this like hydrophilic look, and you literally glow. Like this week, I was like, I don't even want to wear makeup. Let me like throw on some concealer, but that's like all I feel like I need.
Nice.
Love that. And can you put this anywhere? Like when you do the Barbie Botox, can you do this there too?
Daxxi can go anywhere. Daxxi is very, very safe to put anywhere too. Some people are scared because it lasts so long, but honestly, it is a very controlled molecule because I like molecules that are very, like, I put it where I want it to stay instead of it, you know, spreading just a little too much. So this is really good for really any area. Raquel, we did her DAO, so that downturn of the mouth, we did hers with her Daxxi, and it looks beautiful. I feel very, very comfortable with this molecule size.
Awesome.
Can you even do like a lip flip with it?
Oh yes, Raquel's lip flip right now. She was like, oh, it flipped. Yes, it looks
I love
really
a lip
good.
flip.
So with Daxxi, the dosing is always like basically double. So I usually in each of these dots put 2 Botox units. It's actually 4. So that's something that's different about Daxxi, and that's why you have to use so much. But you get really beautiful results, and they're long lasting. Lift up your brows for me. Relax.
Christian, your lips look so good.
My lips.
She was just.
I know she said you're gonna do a little bit, but they look amazing.
Well, Christine did my lips. Christine, what do we use on my lips?
We used RHA 3, which is definitely one of my faves. I love different fillers for different things, but I feel like we wanted to give you a pout, but not too drastic. But you remember when we did your lips? You were like, ah.
I was scared at first.
She was like, ah. It's a trust the process kind of deal, though.
Now everybody asking, who does your lips? Who does your lips? Christine.
So we also did on Christian, we did some Sculptra. That is like, if you're one of my patients, you know I'm obsessed with Sculptra. We did Sculptra on Christian. How many months ago, Christian?
Sculptor was on June 6th. That's my birthday.
Yes.
How much weight have you lost from semaglutide?
Oh my gosh. I've lost 56 pounds on semaglutide. That was over the course of a year, so I did spread out my injectables. Once I got closer to my goal weight, I started using it more for maintenance. So with that drastic weight loss from semaglutide, I had a lot of skin laxity. And so that's what, of course, caused me to decide to have my consultation with Dr. Courtney. I had a lot of skin laxity on my chin area, my arms, my abdomen. So what we ended up doing after I lost all that weight from semaglutide was even my breasts, of course, were drastically deflated from the weight loss. So then we went back in with Dr. Courtney, of course, and that's where we did lipo to the areas that I just mentioned, as well as Renuvion.
What's Renuvion?
So Renuvion is previously known as J Plasma, and it is helium, and that is used to tighten your skin. So essentially, he goes into those areas and he sucks out the remaining fat that I had, that stubborn fat that was still in random spots after the weight loss. Mm-hmm. And then he went back in and just tightened me up with the Renuvion. So it's skin tightening. It basically shrink wraps your skin. And there are immediate results, and then the results continue to kick in over the span of, a year. So my arms beforehand, I used to make the joke like I had the bingo arms, and I'll show you in just a second the difference in my arms.
Yeah, don't do that while you're getting injected.
Not while I'm getting injected.
I feel like your jawline.
Oh yeah.
Really, just feels so good.
Yes.
I
So how long
agree with
after the Renuvion skin tightening did you have your consult with Christine for Sculptra to touch up little areas?
So that was 4 months post-op. That she had me for a consultation for facial balancing. And so we did Sculptra, and like how Christine mentioned before, we did Sculptra laterally to help me with some of my laxity here. And then in my temples as well, because when you're losing that much weight, of course you're going to have deficits in your face. And I know a lot of people have called it like the semaglutide look or like the skeleton look, the Ozempic face. But there are things to do about that. So Sculptra is an incredible thing that allows you to rebuild your own collagen. So again, she put that in my temples right here, laterally, in my cheeks here too. And those results take time to set into.
Here you go. You're done.
Christine,
We're
are you using that on a lot of patients?
Tears of joy!
Yes, I use Sculptra all the time, every day. It is my favorite, one of my favorite products because it helps me work off you. It literally just rewinds time, right? So we place it laterally because as we age, we literally have a downfall, right? So this cheek, we start to get that nasolabial fold, we start to get the jowling. Because of that, we need to fix the problem. Like, don't just put a bunch of filler right here. If you do that, yeah, it'll be a quick little fix, but you're not actually addressing the issue. The issue is that we need some lateral support there. So Christian doing all the doing FaceTime with Dr. Courtney, me coming in with Sculptra and providing some lateral lift. It looks amazing. It's looking so good.
You look
And
gorgeous.
It does take a while. Sculptra takes about 3 to 4 months to develop. It's not a quick fix, but if you trust the process, it's so worth it because at 2 years, you still have 100% of what you developed. Like, Raquel always says, Raquel is here.
Hi, Raquel.
What do you always say about Sculptra?
It's like owning your house, not renting it.
Yes.
Ah, I like it.
A little protein shake for your face.
Yes, ma'am.
Very nice.
Yes, ma'am. So I guess we would reevaluate for my Sculptra within the next
month or two.
Yeah.
And then we'll probably, we can either do more Sculptra or we can do a little bit of cheek to kind of just help to support this area, maybe a little bit in her piriform aperture. But it's looking amazing.
Awesome.
Thank you so much.
Raquel, fill us in on what this noise is we've been hearing
Yes, what is it?
during the live.
I snuck into the back to do my preset, so I'm going to have the patient come in here in just a minute, and we're going to treat an angioma on her face. Cherry angiomas are a vascular condition. They kind of look like red moles, but it's a bundle of vessels that you can usually find on the nose, on the chest, on the back. Really, they show up anywhere, but I'm going to treat her real quick just on her nose to get that cherry angioma treated. It will go from like a pink to red to a purple and then fade into nothing. And it'll be gone. She'll never see it again.
Okay, and what setting are you going to use for this?
So I'm using the clear feed. So instead of using the BBL modality, I'm actually using the 1064 clear feed. And we're just going to treat it real quick. I just did a hydrofacial on her. So we're just going to do that and get her sized so we can zap her and send her on her way.
Awesome. Bye, guys.